and welcome to another edition of Gloria Teaches You Clin Med. Specifically, we're going over PEDS unit. We're going over selected nutritional disorders in infants, all right? And so nutritional deficiencies may result from internal causes, and things like blood loss, malabsorption, or chronic disease can cause nutritional deficiencies. There are also external causes, and so external causes are inappropriate feeding. Maybe there's psychosocial distress of the infant, inability to take in sufficient nutrition, so maybe some kind of problem with motility. All right, so what is the ideal source of infant nutrition? So the answer to that question is breast milk, because it contains a perfect mix of nutrients as well as protein, lipids, and carbohydrates. And so protein, lipids, and carbohydrates, in case you didn't know, is essentially your macronutrients. And this perfect mix of nutrients promotes bonding. It also strengthens the immune system of the infant. And it makes sense because the mom was, carrying this baby for whatever, nine-ish months, right? And so it makes sense that biologically and evolutionally we have created some kind of food for the baby, with our own hormones and all of our body materials, and to produce the perfect food for our baby that we were carrying. And so that's breast milk. All right, and infant formulas today, they come pretty close to matching breast milk and in terms of providing energy and nutrition. However, at the end of the day, we always know breast milk is the best nutrition for the newborn baby. All right, so the typical infant diet should consist of breast milk and or formula until 6 months of age, and then cereal may be introduced at 4 months, fruit at 5 months, vegetables at 6 months, and complex proteins in the months that follow. And for me, when I read that, I'm like, that is insane that by 4 months you can give a baby cereal. Like, that's so, for me, it seems so early. I don't know, but that's pretty cool. So you have cereal at 4 months. Wow, there is a plastic bag floating in the sky. It's literally just like floating. It's very humorous. So, fruit at 5 months, vegetables at 6 months, and complex proteins in the months that follows, which makes sense that, so in your digestive system, if you think simple carbs is the easiest thing for humans to digest. This is because glucose is the simplest unit that we digest. I don't know how to explain this. So essentially, if you think, this is the way I'm going to explain it. It might be more complicated, but liver, right? The cell is the hepatocyte, right? But before the hepatocyte, there were parts of the liver, like the right lobe and the left lobe. And then if you go smaller, then it's a tinier part. But the hepatocyte is the smallest unit of the liver, right? And so what I'm trying to say is glucose is the smallest unit that we will use to process, the small unit of energy that we use in our body, right? And so protein is broken down all the way down into usable glucose, and then fats as well is broken down, and then it becomes into glucose, and that's what we use for our brain, what we use for our muscles and to function. And so if you give a person proteins versus a person regular carbs, then obviously the carbs are going to be easier to digest. So that's why you give fruits earlier, cereals earlier, and then fats as well will be later on. All right, and so rice cereal may be introduced earlier than 6 months based on weight and appetite. Barley, oatmeal, or wheat are not recommended sooner and should be delayed. And my reason behind this, this is just my thoughts upon reading this, is because wheat I shouldn't say that. Wheat contains gluten, and this is a protein that, if you think of it, it's like a kind of a gluey substance. It binds things together. It gives it structure, and so this can be harder to digest in people. But in general, rice versus wheat, no matter if you have a gluten intolerance or celiac disease, wheat will be harder to digest than rice because rice doesn't have that protein profile that wheat has. And then barley's the same. It does have gluten. Oatmeal doesn't have gluten. However, I would imagine that it's harder to digest than rice, all right? Earlier initiation of certain foods may be associated with development of food allergies. So this is just saying that sometimes if you give the food too soon, how do you know when it's too soon? But if you give it too soon, you might develop a food allergy, so you might want to wait longer to initiate some foods that are more associated with food allergies. And then cow's milk with low fat content should be initiated no earlier than what age? So my question is, after what age can you give a baby cow's milk? So the answer to that is after 1 year old, and it's low fat. All right, so now we're going over 5 specific selected nutrient or nutritional disorders, and those 5 are, let's start with protein. Then we're going to go to carbohydrate, vitamin K, fluoride, and iron. All right, so protein. We're going to be going over risk factors for this nutritional deficiency. We're going over clinical features, so like signs and symptoms, and then diagnosis. So specific lab tests, and number 4 will be treatment of the nutritional disorder or deficiency. All right, so protein. So risk factors for developing a deficiency in protein is the body cannot store protein, so a daily supply is needed. Maybe you have a severe skin disease or burn, and then cystic fibrosis. So when I was working as a patient care assistant at a rehab hospital, patients would come in, very rarely, but when they did come in with severe burns, they actually have a higher protein. They need a higher amount of protein just because their body is in so much distress. They're repairing so much, and they need a lot more. They have higher metabolic needs, is what I'm trying to say. When patients have burns, so if you have severe skin disease or burns, then you're going to need higher protein. And cystic fibrosis, it makes sense. I'm going to be honest, I don't know the exact definition of cystic fibrosis, but I know it's a condition where your body needs to work harder than average, and so you have higher metabolic activity. You have higher needs of metabolism, all right? So clinical features of a protein deficiency, you'll have impaired growth velocity. The severest form of protein deficiency is kwashiorkor, and that will result in lethargy, irritability, impaired growth velocity, edema, and hepatomegaly, which is enlarged liver. Edema is where you have swelling of the, usually the extremities, but it can happen anywhere, essentially. All right, so diagnosis of protein growth deficiency. You're going to want to do a chemistry panel, and this chemistry panel may show a decreased albumin level, which is a protein, and then you're going to do a CBC as well, and it might show some other deficiencies. And then treatment for a protein deficiency is to adjust the diet, and most importantly, increase the daily intake of protein as best as you can. There are actually liquid forms of proteins, which is really cool, so you could put it in a smoothie, and if you make the smoothie right, you can mask the taste of the protein liquid that you put in the smoothie. And there's just, I think it's all about being creative in how you're giving the protein to it for the kid, whatever food they like. Somehow incorporate, if they like spaghetti, right? They like the flavor of the pasta sauce, but they also like the noodles, so incorporating as much protein as you can in the spaghetti if they like it. If they like cereal, for instance, right? It's sweet, a lot of kids like that. So then maybe try adding some of the liquid form of the protein into the milk of the cereal, as long as it doesn't really, look different and it doesn't taste as weird, but as long as they can still taste the cereal, the thing that they like to eat, and then you just add the protein in, and maybe they can develop a liking for that too. And then the other thing that I can think of is if they like, banana bread or baked goods like that, it's very easy to add like protein powder into. You can make protein pancakes for kids, or make just some kind of protein cookies or something like that. I think it's kind of fun to be creative like that. And let me just get off this tangent of talking about food and baking. All right, so carbohydrate. deficiency. So the risk factor is daily supply is required because of the body's limited ability to store excess carbs. And so risk factors for development of carbohydrate deficiency are galactosemia, which is inborn error of metabolism. Diarrhea can cause carbohydrate deficiency, malabsorption, improper diet. Excess intake results in obesity and increased risk of type 2 diabetes mellitus. I just combined those two. All right, diabetes. I could just call it diabetes. I don't know what I'm saying now. All right, so clinical features of carbohydrate deficiency: impaired growth velocity, just like in protein deficiency, obesity, marasmus is okay. So marasmus. So if you have a coin, right? This is a coin. So one side of the coin is kwashiorkor, and the other side is So one side of the coin is kwashiorkor, the other side of the coin is marasmus. So kwashiorkor, protein deficiency, the other side of that is carbohydrate deficiency, marasmus, and this is a severe form of malnutrition, and it results from multiple dietary deficiencies, including a lack of carbohydrates, all right? And how you diagnose a carbohydrate deficiency is a chemistry panel, and it may suggest electrolyte imbalances, and then you'll also do a CBC as well. And then the treatment for carbohydrate deficiency is to adjust the diet. The way you're going to remember kwashiorkor as a protein deficiency is the abbreviation. Maybe you eat a lot of protein, so you're like, kwashiorkor. That's how you do it. You're like, just the name kwashiorkor versus marasmus. Kwashiorkor sounds so much more like, like squash. So then you're going to think protein, because when you have a lot of muscle, because when you eat a lot of protein and then work out a lot, you can get super buff, and then you're like, you want to squash people because you're so big and buff. All right, next one, vitamin K deficiency. So vitamin K is very, 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 very important in the role of coagulation proteins. So it's important for forming coagulation proteins. So if you have a deficiency in vitamin K, then you will not be able to produce coagulation proteins. That means you won't be able to clot as well, so you'll have problems with bleeding, all right? And so risk factors for development of vitamin K deficiency are newborns, breastfed newborns who do not receive vitamin K prophylactically at birth. All right, clinical features of a vitamin K deficiency are hemorrhagic purpura, involving skin, internal organs, and CNS, and it may be fatal. And so hemorrhagic meaning bleeding, and then purpura meaning like purple spots is what I think of. All right, and then examination. So diagnosis, you're going to look at vitamin K levels, and then you're also going to test prothrombin time, and if it's prolonged, so it takes you a longer time to clot, right? So that means that might indicate you have a vitamin K deficiency. And how do you treat this? Intramuscular vitamin K injection, all right? Though I do want to point out, I just learned in my pharmacology class to not give premature infants or preemies IM injections. So I don't know what you do in that situation. However, for typical infants with vitamin K deficiency, you give them a vitamin K injection intramuscularly. All right, fluoride deficiency, next one, the fourth one that we're going over today. Fluoride is incorporated into the tooth matrix. So you know how we have toothpaste, right? And we brush our teeth, and that has fluoride. So fluoride is very, very important in the development of teeth, all right? It increases resistance to dental caries, so cavities, and this element is contained in most public water sources. Fluoride, some clinical features are increased number of fluoride deficiency. The way it will present clinically will be increased number of dental caries or cavities, and in the case of fluoridosis, you're going to look for under mineralization and discolored teeth. All right, so discolored teeth can be a sign of a fluoride deficiency. You diagnose this by doing a dental examination. You look at the teeth, and then you treat this. So you want to consider supplementation after 6 months of age when the water source does not contain fluoride. All right, last nutritional disorder, we're going to go over iron. So risk factors for development are breastfed infants, untreated maternal anemia, prematurity, and finally blood loss during the neonatal period. Clinical features of iron deficiency are asymptomatic when mild. You can get pallor, so since you're not producing hemoglobin, then you are going to look pale. Fatigue, impaired cognitive and motor development, and finally pica. Ooh, pica. I looked that up. That's relevant. And I want to say pica is this thing where you like bite everything and you chew something and put things in your mouth because you desire iron and so you eat random objects. All right, so diagnosis is CBC with differential, serum ferritin, serum iron level, total iron binding capacity, and reticulocyte count, which is a blood cell, immature blood cell, red blood cell. And then how are you going to treat iron deficiency? You're going to give food with high iron content, supplementation, and finally for breastfed infants, you're going to introduce iron fortified cereals at 4 to 6 months, because we said earlier that at 4 months you start introducing cereals, so you really want to pick a cereal with iron fortification. And that is all for selected nutritional disorders. Good luck on your exam. Bye!